Beets are an excellent source of vitamins A, K, and they strengthen your brain. It's like your brain doing sit-ups while planking after a marathon.
My name is Patty. I'm sent from the local hospital. This is part of the Health Awareness Week on beta blockers. And you two are the only ones who did not pass the exam. So we have to go through this presentation again today.
Question. Does this certify me in any way, shape, or form?
No, Dwight. It allows the corporate office to have the healthcare information in your file here.
Question.
Dwight, let's just hold on to questions until after your second try of taking this exam.
Beta vulgaris, otherwise known as the common beet.
So the actions of the beta blockers, they block stimulation of the beta-1 adrenergic receptors. Therapeutic effects, they decrease the blood pressure and heart rate, decrease frequency of attacks of angina pectoris, and the pharmacokinetics for the absorption, well absorbed after oral administration. It distributes across the blood-borne barrier, crosses the placenta. Small amounts do enter the breast milk. Metabolism and excretion, it's metabolized by the liver. And the contraindications for the medications and the precautions: uncompensated heart failure, pulmonary edema, cardiogenic shock, and bradycardia. So when you're using this medication, you want to use caution in patients with renal impairment, liver impairment, and for the geriatrics, increased sensitivity to the beta blockers, pulmonary disease, or diabetes. For the OB patients, lactation, and the pediatric patients, safety has not been established. The adverse side effects and reactions are fatigue, weakness, bradycardia, heart failure, pulmonary edema, and erectile dysfunction.
Lame. Beta blockers don't even compare to beta vulgaris. Question. If you were on a desert island, what would help you more? A beta blocker or a bushel of beets?
Well, if Ryan wasn't with me, then beta blockers to end my life. Wait, do I have a phone? Ryan and I could totally do the distance relationship.
I didn't find out that the natural color of pee was yellow until the age 12.
And beta blockers, just kind of an indication of the medication, all end in LOL.
LOL. I was just sending that to Ryan. He says we should take a shot every time she says a word that ends in LOL.
I'll get the fermented beet juice.
No, Dwight. We could all be fired for drinking in the office today.
I'm in their heads. I say beets 45 times a day. I replace the jelly donuts with beet puree. They come to me for their beets.
You two are not allowed to be paid overtime for this training. So please sign your names at the bottom of the exam and I'll complete the rest. And please punch out within the next 5 minutes.
I messed around on my phone for an entire day and got paid. So bite me, beta blockers.
Alright, that's enough with the fun and games. When giving metoprolol, the nurse needs to make sure to assess the BP and pulse before giving the medication. If the pulse is below 60 beats per minute, the nurse needs to hold the medication.
Remember, Dad, you're on a beta blocker. So, when I'm digging in the garbage, don't jump up too fast to come stop me. Make sure to change position slowly.
Metoprolol has a black box warning. This medication should never, ever be abruptly discontinued. When discontinuing this medication, it needs to be done over the course of 1 to 2 weeks. And if signs of angina begin when discontinuing, the medication needs to be reintroduced.
Beta blockers, such as metoprolol, should always be taken with or immediately following a meal.
Patients taking metoprolol may notice an increase in labs such as uric acid, lipids, potassium, bilirubin, alkaline phosphates, creatine, and ANA.
Beta blockers like metoprolol can increase your sensitivity to cold weather, so make sure you get them nuts packed in before the cold weather hits.
Elderly patients should receive a lower dose of metoprolol, at least at the beginning, due to their higher risk of falls and dizziness than that of a middle-aged person. Metoprolol is a pregnancy category C.